Hey everyone, it's Dr. Hodges, and like a lot of my patients, I do take a little GLP-1. So what I wanted to kind of show you guys is how you need to take the medicine, how you draw it up, and then just some little pointers whenever you're taking any GLP-1. Okay, so let's get started. Okay, so typically whenever you're getting a GLP-1, it will come in a refrigerated container. It all depends on the particular pharmacy that you're using. For this particular pharmacy, it comes in a box and in a styrofoam container. I've also had some where it will come in an insulated envelope. Doesn't really matter. You just want to make sure that it's insulated. Luckily right now, it's really cold outside, so it doesn't matter that this was dropped off at the house and sitting outside. I think for a while, it probably was colder outside than it was in our fridge. But certainly during the summer months, you want to make sure that you're following along with your delivery so that as soon as it's delivered, you can get this put into the fridge if you're not ready to take your medicine. So typically when you open it up, like there'll be information on, like basic information on the medication. What I like about this particular pharmacy is that they have some do's and don'ts. If you're one of my patients, I will go over how many units you need to take because it's really dependent upon the concentration and what your dose is and the pharmacy that is compounding the medication. So in this pack, as you can see, you're going to get, it's a styrofoam. I actually keep these little ice things and I keep them in the freezer for future use, and I'll use them in the summertime because they're great pre-made ice packs. And typically you're going to get the medication that is in a vial, and you'll get some little alcohol swabs. And then you're also going to get your syringes. You do not have, there's nothing magical about these syringes. You can order them off of Amazon if you need to get more. These are going to be U100 insulin syringes. And what it is going to be, I'm going to go ahead and open this up. I don't have a pair of scissors. We'll just use that. But on this, let's see, can you come in a little bit closer, baby? On this syringe, you can see that it is labeled 10 to 100. And so you will be giving yourself typically a shot within either 10 or 15 unit increments. So for me, I'm going to be giving myself 7.5 milligrams. For this particular pharmacy, that is going to be right at 30 units. So I'm going to open this up. Open up. Oh my gosh. It's funny. I'm like doing an unboxing video for medicine. And so this has a little cap. The first cap that you use, you do not need to, you don't have to clean it. So I'm going to pop that cap off. Every subsequent time that you're using this same multi-use vial, you need to make sure that you're using an alcohol swab to clean this off. That way when you stab the little diaphragm, you're not introducing any bacteria into your medication, okay? But this was a first time use. I popped the cap. So first thing that I'm going to do, this protects the plunger. This protects the needle, okay? Now, I want to take in 30 units. So what I do is you turn the bottle upside down, stab the diaphragm, and then you're going to draw up, and I always bring it down a whole further past where I want to go because we don't want any air. And so it's going to fill up to 30 units. And then what I do is I squeeze some of it back in to get rid of any of the air bubbles. That's why I drop a little bit more. Now I have 30 units in my syringe. Oh my goodness. I can hear my dog. She's chewing on the cap. Pepe! Let go of that cap. All right. And now what we're going to do, we're going to take this. All right. Can you show them this, baby? This is my skin. You just dab with with a little alcohol swab. What I like to do is I pinch my skin where I can feel it. And then if you do that, then you don't even feel it going in. It's a really tiny needle. You just put the whole thing in. 1, 2, 3. And then you deploy it all the way and then take it off. And then there you go. Okay. And so it's really easy to give yourself one of these shots. I usually will recap this. It's a single-use syringe. You can just, once you have that cap on, you can just pitch it in the trash. You can also, if you have a little sharps container, you can stick it in there. But honestly, once I put the cap on and I know it's secured, I'll put it in the trash. Sometimes if I have like a water bottle or something like that, I'll even take all my syringes and put it in that and then put the lid on, and then I'll throw that water bottle away. So you can certainly do that as well. So what are some things to think about if you're giving yourself a GLP-1, whether it's semaglutide, tirzepatide, Wegovy, Ozempic, Zepbound, Mounjaro, tirzepatide. If it's any one of those, these are some things to remember. Number one, the most common side effects that patients might get are going to be nausea, constipation, and or headache. I have gotten at times arthritis, some arthralgia. That's not uncommon. And certainly if you're taking lower doses, you might not get all of the side effects, but as you increase the dose, you can develop more of those side effects. So that's number one. Number two, it is normal for you to have to increase the dose. I kind of think of your appetite like being pregnant. Either you are or you aren't. You're not just kind of pregnant. That's also how your appetite is. And so I might have new patients come to see me for the first time and they want medicine and they want the highest dose. And I tell them, no, that is not what you need. What you need is the lowest dose that's the most effective. And the reason why is over time, you're going to be tolerant to that appetite suppression. The primary goal of these medications is not for weight loss. They were developed to control your hemoglobin A1C. And what they do is when you take the medicine, if your glucose gets, and it's going to be dependent on each individual patient, once it gets up above a certain amount, then it kicks your pancreas into high gear to release more insulin. It does not work like straight up insulin or metformin, where if your glucose is high or even if it's normal, if I give you a shot of insulin, your glucose is going to drop. That is not how these work. And that's why patients that are not diabetic, why they can safely take these medicines, it's because it is not an immediate effect. It's like a secondary effect. So your glucose has to get up and above a certain amount before extra insulin is released. That is also why if you're taking these medicines, if you have too much simple carbohydrate or if you have too much fat, the medicine is going to kick in and you're going to get more of a release of insulin. That's why you might get really nauseated or not feel well if you're not doing the things you need to do whenever you take these medicines. And I know you guys are out there and you're like, I don't know why I feel this way. I'm like, you have to do the right thing. Because the third thing I want you to know is there is nothing magical about these medications, okay? The medications do not make you lose weight. All these medications do is provide a side effect of appetite suppression that over time you can become tolerant to. And so just like with insulin, you take insulin, it causes an immediate release and an immediate drop in your glucose. That is like a primary response. Your weight loss is not primary. Your weight loss when you take this medicine is secondary or even tertiary. And this is what I mean. You take the medicine and it suppresses your appetite. And that appetite suppression is really a secondary thing that is occurring in your body. The appetite suppression then allows you to remain in a calorie deficit. You remain in a calorie deficit, and then the third step is you lose weight. So the first thing you have to do is take your medicine as prescribed. Number two, you then need to make sure that you are in a calorie deficit, either with food or with exercise or with both. And then that has to be consistent. And once you get those things completed, then you'll begin to lose weight. But it's not that I'm going to take this medicine and I'm going to start losing weight. So if you are taking a medicine, whether it's a GLP-1, whether it's phentermine, combination of those, if you're taking Contrave, Wellbutrin, naltrexone, whatever medicine is that you're taking, you have to make sure that you are in a calorie deficit. And so I have talked about this before. Go ahead and you can, and I'll have it linked below. I want you to get your basal metabolic rate, your BMR, that will tell us how many calories you need on any given day to maintain your weight. What you then need to do is take that number and subtract 500, and then that will tell you how many calories you need a day to lose weight. You need to be in a 500 calorie deficit every day to lose 1 pound a week. For me, my metabolic rate is kind of crummy. It's about 1100. I would never tell anybody 11 minus 5 is 6. I would never tell anybody to only consistently do 600 calories a day. So for me, what I do is I keep my calories around 900 to 1,000. That gives me like a 200 calorie deficit. And then I know I'm going to get a deeper deficit whenever I go out for my walks. So if I'm consistent taking my medicine, number one, if I'm consistent staying in my calorie deficit, number two, and then number three, if I'm also exercising, that is the surefire way to know that I'm in a complete calorie deficit and I will constantly be losing weight. So if you find that you are plateauing and you are on a weight loss program, the very first thing I want you to do is get back to the basics. I want you to, number one, find out what your BMR is. And number two, you need to start logging your calories because you need to see exactly where your calories are coming from, because they're coming from all over the place. They're coming from the coffee creamer that you put in your coffee. They're coming from that little snack you had. They're coming from your meals. They're coming from that fruit drink that you drink every day that's supposed to be healthy because it's all natural. Doesn't matter. It has a calorie. It may be causing you to eat at maintenance, which is your BMR, as opposed to being in a calorie deficit. So those are just some things to think about. But I hope that this little tutorial helped you guys, and get on out there. It is the beginning of the year. Let's find ways that we can stick with our New Year's resolutions.